It was one of my new complex case patients. She's a 20-year-old female that was in the hospital for about a month for dysphagia and celiac disease. She was very underweight, very malnourished, phobia of eating. After all the diagnostics tests that they had done at the hospital, everything was negative. They even did an ENT. So she was cleared. The inpatient team decided to refer her to complex case management. So I took over as her case manager. I was able to establish a rapport with her, but I felt like she needed additional support. So I asked permission from the patient and her mother, who she wanted her involved in the case, and I said, I think it would be very beneficial to your care if you spoke with our behavioral health licensed social worker, because they have a lot of knowledge and a little more profession in this particular field. So I outreached to Rain, and Rain was able to hone in on the patient and assess their needs. It turned out the patient's family was paying out of pocket when they shouldn't be. They were, paying a lot for a provider that wasn't even a specialist in the as a food professionalist, I guess you could say, for a psychologist. So Rain was able to find all these different providers to help the family who was at a standstill and recognize they don't have to pay out of pocket, just stay within your insurance provider. So that saved them money. Also, to find a psych eval that is more specialized in this pseudo dysphagia that the patient's having. So the patient, the family, and myself are very thankful that Rain has been able to outreach to them. And so going forward, the patient, I think, is going to make a lot more progress than where she was at, and hopefully prevent her from being out of the hospital.